I want to thank you guys for joining our very, very first inaugural rounds. I know a lot of people are busy with kids at this time of day and busy with clients. So we're actually trying to figure out the best time of the day to do this. And we've actually had quite a bit of interest from people, weirdly enough, in Australia. So the next one may be later in the day so we can catch the Australia crew at the same time and we can share ideas from all around the world. So the whole idea of the Brainnovation rounds is actually to help bring in people who have a passion for brain health and building a brain health business, share ideas, share resources, and use different strategies to help us all kind of raise the standard of care around brain health more globally. So I'm excited that you're here. It's a small but mighty group, and I'm looking forward to some really great conversations. So in today's session, we're really going to just talk about, again, to review the purpose of the Brainnovation Network, which is to really create a voluntary group of forward-thinking clinicians who have a passion for this area of practice and help us work together to equip clinics to be brain health treatment centers and to look at not just brain recovery, but also brain health. So I found a couple of really interesting stats. So really there's a huge amount of growth in the brain health market worldwide right now. And they're saying that it's actually the second fastest growing area in the health and wellness. And right now there's a huge global market for brain health, memory, concussion care, and just globally management of early cognitive decline and brain fog and things related even to the COVID crisis. It's amazing how many people came out of COVID with long COVID and are still struggling with some of those things. So when I send you the link to the presentation, you'll see there's some embedded links in there that you can dive a little bit deeper into this data if you'd
Okay,
like.
let's go.
And I'm not sure, Patty, I'm just going to give you a quick ask. I know on my screen, because of where the people are located on the screen,
Yes.
it's cutting off the side of the slide. Is it doing that for you as well, or is it just for me?
No, I think it might just be for you.
Okay, perfect. I'm just going to reposition some of the people so that I can read. So it's really interesting that over the last kind of 4 or 5 years, there's been
Reed, I
this,
gotta go, man.
oh, Nicole.
Oh, sorry.
That's okay, no worries. There's been this huge advent of digital brain health tools. So not just NeuroCatch, but all kinds of online resources, brain training, metabolic health programs, digital health and DNA testing. It's just been quite remarkable to watch how that has grown over the last little while. And we've had sort of a front seat into some of the innovation that's going on because of our brain health research lab and the fact that we're doing clinical trials on emerging technologies. We're actually starting to see some of the neat tools that are being developed out there in the marketplace. So it's exciting to see how far we've come in such a short period of time, and it's really important for us to kind of stay ahead of the curve to the extent that we can. So, yeah, over 2 billion people worldwide suffer from brain-based health and productivity challenges. And the global economic burden, of course, is absolutely huge. I know this data was from way back in 2017, and now they're actually even predicting higher numbers than the 2 trillion. So again, there were some really interesting stats. There was a group called Sharp Brains that was doing kind of predictions around the global brain health market. And they were saying that more than 1 million adults in North America alone will take a self-administered annual brain health checkup via like a tablet or something like that. We actually have been talking to a chain of drugstores, and they're not really grocery stores, they're more kind of health stores that are talking about putting like little kiosks in where people can come in and do a bunch of health testing just independently in the drugstore and get a health score and then some advice around what to do. And currently it's more kind of around heart health and other kinds of metabolic health measures, but there's a really strong interest in creating a tool for brain health, and we're collaborating to talk about what that might look like. There's also more than 1 million amateur athletes dealing with concussions and who are needing baseline testing, and that's another area that's really growing. It's interesting because we at Health Tech Connects don't use the term baseline. because baseline kind of suggests that it's a static thing and that it doesn't change and that you just move up or down from it based on injury. But we actually call it a benchmark assessment because we know that it's dynamic and it actually is affected by a million things: what you ate, how you slept, and how your general kind of metabolic health is, which is changeable. So, and we really like to reflect that it's dynamic, and that the fact that it's changeable is a positive thing in that we can affect change in brain health just through a lot of different kinds of measures. And actually, I'm thrilled to see that Dr. Bessman's on the line with us because I know he's doing a clinical trial on a nootropic, and we've been doing a lot of work with nootropics over the last little while as well. And we've been seeing some really significant changes. So, if looking into like nutritional or supplement information is something that is of interest to you, then there are quite a few of us in this group that actually have a special interest in that area, and we're happy to help you kind of identify what some current protocols might be. And then obviously biometrics aided meditation. A lot of you are seeing apps like Calm and Mindspace and a bunch of other apps that people are using, Insight Timer, to help kind of calm the nervous system, and they're getting more and more frequently used in kind of employee wellness environments. Then, of course, they say iPad-based cognitive screening, but really it's any kind of tablet that can look at different aspects of reaction time, cognitive performance, and those kinds of things. And now, rather than doing these really complex neuroimaging scans, we can look at simpler things like NeuroCatch and other tools like it to look at how cognition is progressing over time. And then MS is another area where they're really kind of pairing physical rehab with cognitive rehab. And there's some drug-based therapies that are emerging as well. And one of the interesting areas that NeuroCatch is now sort of shifting into is looking at titrating medications, because often with antidepressant meds or all kinds of ADHD meds, it's kind of a shot in the dark and watching to see subjectively how people describe changes in their symptoms. Whereas with NeuroCatch, we can actually do a scan pre and post medication administration and look at whether or not it's doing what's intended, or whether it's too strong and it's making them more hypervigilant, or whether it, puts them into the sweet spot. So it'll be interesting to see how that progresses over time as we kind of move more into the primary care physician space to support what we're doing already in the rehab space. And then it says here, and this again, these were from a while back. But at least one major insurer will launch an educational campaign to help adults proactively take charge of their own brain fitness. And I actually am gratified to say that at this stage, most major insurers are actually looking at that. So it's not even just one. So all of the predictions that they were making way back then, I think these were all mostly from 2018, have already come to fruition. And there are some really cool programs. I know one in particular, one group that we're talking to is Manulife. Manulife actually created a benefits plan called Vitality, where it actually measures you based on your health behavior. So they have an app, and if you check into the gym, they log in, and if you check into a health food store, you're logging different health behaviors, that your premiums actually come down based on your health behaviors. And so they are actually looking at some different kinds of programming that involve not just your physical health or your metabolic health, but also your brain health. And they may be layering in some tools around measuring brain health and metabolic health that help people keep their premiums at a reasonable level and actually incent healthy habits. So, as we're kind of talking with insurers and we're talking with sports teams and we're working in this space to help advance brain health, there will be some really great opportunities for pilots. And part of the reason that we built the Brainnovation Network is so that we have a network of clinics that can work alongside us when we get opportunities like this to help scale some of these ideas and bring them to life in the real world. So please feel free to unmute anytime. If anything that I'm saying like sparks a thought or a question or something that runs wild in your brain that you don't want to wait until the end for, please, please, please just unmute and interrupt me. I don't mind at all. These rounds are designed to be conversational and interactive and stimulate ideas across different verticals of the brain health space. Because in our Brainnovation Network, we have some physicians, we have some occupational therapists, we have PTs, we have people more in the health and wellness space. So I really want to have this be an opportunity to cross-pollinate ideas. So we're just talking about the determinants of health a while back in a presentation. It was so interesting to me. And Zaina Kayat is Canadian, actually. She's wonderful. And she talks a lot about the social determinants of health. And it's interesting to see like what the different determinants are versus where we actually invest our money in Canada and I think in North America more globally. But access to care is a big determinant. So we're looking at different kinds of strategies around the brain health space where we're making sure that not everything has to be delivered in person, that we actually have strategies to get to rural and remote communities. We are actually working with a company that does DNA testing, and they do a very specific brain health report where they talk about how your DNA might have some influence on how you develop different kinds of brain conditions, and also some of your nutritional things and what you digest and don't digest, understanding that metabolic health and brain health go hand in hand. Looking at where you live has an impact. The behavioral side of things, which is, something that we as allied health professionals kind of dabble in, but we often don't have the whole interdisciplinary presence where we layer in counseling and other behavioral health strategies and habit management and those kinds of things. That's the biggest predictor or the biggest determinant of health. And yet it's one of the pieces that I think we have the most room to grow in. And then interactions of the above. So, certainly in our healthcare system, we're focused predominantly on medical care and very little on behavioral health. And we're actually finding that where we can move the needle the most and the fastest is on the behavioral health side. So I think it behooves us as healthcare practitioners to look at the bigger picture and how we can affect people's health habits in addition to just treating what they come in with. And then again, this is sort of along the same lines, like the other determinants of health, income and social status, employment and working conditions, literacy, childhood experiences, all these kinds of physical environment, social supports, healthy behaviors, access to health services, biology and genetics, gender, culture, race. So by looking at the determinants of health that we think we can influence, we can certainly have an impact on how people recover and thrive in the world. And I think by limiting ourselves specifically just to an orthopedic aspect or just to a cognitive aspect, we kind of limit our ability to help people make fulsome and complete lifestyle changes that actually improve their health beyond the term of time that we are with them. I'm just going to take a little rest because that's a lot of talking. And I want to invite the people on the call just to unmute for a second and just tell me how that lands for you, what that brings to mind, or how that hit you in terms of feedback around what you're doing or what you hope to do.
I love the idea of working with doctors with doing what we're hoping the meds do. I think that is fantastic what you said, and having the whole metabolic, the whole round picture supported, from the brain health to the nutrition and the metabolic testing. I think that it would just be such a game changer for so many people.
Yeah. And those things are easy to layer in. Like the people that are doing the brain health kind of DNA assessment, it's a really simple, not super expensive thing that gives them a very customized kind of view into how they might customize their own program or how we might customize their program for them. And it's beautiful because the lifestyle factors and the education around healthy habits and sleep and nutrition and hydration and all of those important aspects of health, often we're not delivering those things in our care environments, but it's relatively easy to add them in. And Dr. Bestman, I'm sure you have something to say. I would love to hear your take on this because you have a few more of these tools at your disposal, but yeah. Oh, I think you're muted.
Mm-hmm.
No.
How's
Very
that?
Perfect.
perfect.
Okay, good. I'm actually here in Halifax at the Chronic Pain Center of Excellence meeting for veterans affairs.
Oh,
Oh, yay.
So
yes.
yeah, I'm supposed to say hi to you from Tom Carter.
Oh, that's wonderful.
And so
Excellent.
yeah, he was raving about all your vision, and I have to say everything you're saying resonates perfectly. I think the whole notion of healthcare, it needs to be turned on its head because that slide, I think that says it all. That
Yeah.
90%, and 9% access. It just has to be reiterated. And people are sold that Kool-Aid that you can go to the doctor, get your brain
Yes.
fixed, and somehow magically take a pill or whatever to solve things. And slowly it's changing, but I think what's really nice, and that's been the great thing with the NeuroCatch for me, it's given me a tool. It's not perfect by any means. I mean, it's a start to give some metrics to the patient to show them this is what's actually happening. Otherwise, it's just he said, she said, and we're going on subjective data, which is not irrelevant, but subjective data is still just subjective data. So, yeah, everything you're saying resonates with me loud and clear. Yeah.
That's awesome. Would you mind telling the rest of the group how you use the neural catch in your practice? Because you have some really innovative ways of using it. Like normally, in the physio setting in particular, we're very fixated on the N400 and the
Mhm,
cognitive processing speed as, a predictor of falls or gait or balance, or
mhm,
looking at athletic performance and how fast those milliseconds matter if you're a baseball pitcher or a
mhm,
something like that, but
mhm,
you're using it in a completely different context. And so
mhm.
I would love you to share if you wouldn't mind.
And it just happened organically. It's like so many things. We kind of adopted it into the clinic and just started playing with it. And then the questions came afterwards. So it's been over a year now, since June of 2023. And I've been using it in all the independent medical examinations I do in all the traumatic brain injury patients I see. And I treat mostly military veterans and motor vehicle accident patients. So people who've had PTSD, concussion, chronic pain, that triad seems to go together hand in glove. And what we found interesting, and this was before I did any reading about the significance of the P300, is that it was suddenly mapping out in many patients, not all, to be very elevated in amplitude in those that were hypervigilant. And so that's been a really strong interest in how we correlate that with those patients that have very much central nervous system based hypervigilance syndromes that can manifest with pain, anxiety, but in that study we were doing with regards to the nutraceutical and how it influences the P300, there was clearly an influence. And yet the PhD researcher, who was much smarter than I am, noticed that there were two subgroups that in some cases, the people that were like the deer in the headlight freeze response, or maybe even the ADHD folks were like on the low end of the spectrum for the P300, and the others that were more hypervigilant, sort of hyper aware, sympathetic response were on the high end. But if you pull that data, you just get a regression to the mean. And there's a lot of talk about research that shows no effect. But unless you tease out the different populations, you're essentially just getting a no effect and net zero. And I think that's what we're talking about here at the CPCOE. They had a great talk about, do spinal injections work? Well, the net effect is no, they don't work. And yet individual patients will tell us for certain conditions they work. And like everything, I think it's teasing out which patient is the right therapy appropriate for, and for whom might it not be appropriate for. And so I guess we're getting more into the sort of customized or personalized medicine realm, which I think is where this is all headed. It's not, no two concussions are alike. My colleague, Dr. Sean Marshall, put together the Living Concussion Guidelines, said you've seen one concussion patient, you've seen one concussion patient. And
Yes.
I think that says it all. And we lump people together based on diagnosis, even though that's just a very convenient way of boxing them into something, and then wonder why our treatments that are just standardized or care maps don't work. And I think this is where it really leads itself to very much tailor-made solutions for that particular subgroup. Yeah.
Yeah. Yeah.
Yeah.
And now we're using our neural catch a lot with our pain people to look at central nervous system sensitization and how
Mhm.
we're impacting that and
Mhm.
bringing their hypervigilance and their hypersensitivity down, because with the P300 we can see the change, and sometimes
Mm.
we see the change in a single session.
Yes.
We fooled around yesterday with our neural catch, and
Mm.
everybody, because we're a bunch of brain health nerds, we
Mhm.
all brought in all our nootropics from
Mhm.
home, and we were
Mm.
pre and post testing.
Mhm.
And there was a particular nootropic that everyone was recommending that they've been using, and I tried it, and I rescanned myself an hour later, and I could not believe the change.
Mm.
Like
Mm.
my
Mm-hmm.
N100 went from 98 to 70, and
Wow.
my cognitive processing speed went
Mm-hmm.
from 450 to 350, like
Mm.
100
Mm-hmm.
milliseconds
Mm-hmm.
of
Wow.
difference. It was just
Amazing. Yep.
crazy.
Yep.
And so, like, there are lots of things that we can layer in to support the
Mm-hmm.
treatment interventions that we're doing that help people, find a state. And once
Mm-hmm.
their brain knows that state, it's easier to return to. Like, they
Mm-hmm.
understand what fast processing feels like, or they understand what it means to drop their vigilance and feel calm. And
Mm-hmm.
so we're finding that we're able to really start fine-tuning our treatments now based on the information that we're getting from the neural catch scan in a way that we weren't able to do before.
Mm-hmm.
So it's starting to really, all the pieces are starting to come together.
Mm-hmm.
So I'm going to roll through a few more slides. So, here's the concussion market. So what you can see, kind of modest change in the concussion market. I think partly because we're getting a better handle on concussions now. We're doing more in sport to kind of address and notice and not necessarily prevent yet. I think we still have a lot of work to do to help prevent, but supplements like Cinequel that treat neuroinflammation are neuroprotective. Like, there are some aspects that we can tap into now that will help. But brain health on the whole is growing at an even bigger rate. And I think when we understand that the brain is kind of the overseer of everything from our immune system to our mobility to our sensory perception, and we start treating the brain as part of our treatment plan, I think that we'll see some really interesting changes, and that we won't be so focused on concussion, but focused on all of these different chronic disease conditions that have a brain health component, which there's all of them. And then looking at concussions in Canada, I mainly put concussions in because I know a lot of the people that are part of the Brainnovation Network are in the physiotherapy space. But as we move kind of into this brain health information, it'll be certainly a lot more broad than concussion, but certainly there's a lot of concussions still, in particular in Canada. And one of the things that Dr. Bestman and I and a group of people that are really passionate about treating veterans are getting involved in is actually putting together a program for blast injuries, because it's like having multiple concussions back to back to back to back when you're firing one of those big guns and you get that huge recoil. I think, it's like getting 50 small football hits in a row, and it certainly has an impact on your brain over time. So we'll be looking at, other kinds of injuries besides this kind of standard whiplash injuries, but it's really fascinating to me, some of the features of those kinds of brain injuries. And then, the incidence in Canada, 500 out of 100,000, that's 165,000 people in Canada. And I think that's probably underreported. But yeah, every 3 minutes. That's absolutely incredible to me. And then looking
Wow.
at, yeah, yeah, I know, right? And then, looking at neural catch in particular, where and how it's being used, certainly, it's getting more and more and more broadly adopted. So, we started out actually doing quite a bit of work with Kite at the University of Toronto, and looking at PONS and neuromodulation. Now we're doing work with Mount Sinai and Mass General and SpaceX, some interesting projects with Stanford. We're really getting more and more into the sports world around Red Bull and Premier League and Australian rugby, NBA. So it's funny because we did not expect that sports performance would be that the area that we were going to grow in. We actually kind of anticipated initially that we would launch in and cognitive aging would be the big thing. And certainly in places like Mount Sinai and some of the other places in the US, that is still certainly a focus. But we've just had this little wave lately of people in the NHL and NFL and various different places talking about doing a project right now with the NFL Players Association, not just to help the older football players that are retired from pro football, but also they have a really beautiful initiative right now to help young football players. So getting into the high schools and helping to educate kids about managing their brains at a young age and making sure that they get a full recovery after they've had a concussion so that they're not vulnerable to CT and other things down the road. So it's actually been really fun to look at different ways that people are dynamically using the device. So, obviously looking at benchmarking and neuro rehab, so TBI, stroke, dementia, Parkinson's. We just finished actually a big Parkinson's study with PONS as well, PONS and galvanic stim. And there are lots of interesting things happening. I know Patty's on the call. They're also doing some really interesting work in the stroke area. So I imagine you'll hear a bit more in the next while about, how neuromodulation is progressing. Looking at concussion management, of course, using it as a tool to assess the efficacy of treatments, all different kinds of treatments, whether it's nootropics like Dr. Bestman's doing, or whether it's looking at other, neuromodulation devices like Shiftwave or PONS, and then looking at performance optimization just in general with, veterans, athletes, people that are in high intense environments that require fast thinking. So I want to just talk really quickly about megatrends that are coming. So healthcare analytics is a huge, huge megatrend, and the sector is expected to triple. So 21.1% year-on-year growth rate is astounding. And so, the main kind of consumers of that are professional teams, elite athletes, and consumers, but especially like seniors right now, looking at all kinds of different ways of measuring performance, assessing and measuring progress, looking at fall risk and fall prevention. It's unfortunate there's another clinician that was hoping to be on this call, but she couldn't make it. And they have built a whole business around their neural catch. They've actually created like a performance testing lab in their clinic, and they have chiro, physio, massage, and a bunch of other things. But so not only are they looking at brain health, but they're also testing VO2 max and metabolic health. They're looking at bone density and frailty and fall risk and all kinds of interesting projects. And just in this little rehab clinic now, they have attracted the interest of several provincial governments that are looking at doing fall prevention programs. And I'm hoping as they continue to progress, they're looking for other clinics to help deliver cognitive aging and fall prevention services. And it would be a natural fit for us to pull in the Brainnovation Network to be able to do that. So I think they're testing their model first in New Brunswick. And if they're successful, which I know they will be, because they have a really incredible program around helping seniors who have early signs of cognitive and physical decline, that this might be something that would be a great project to kind of put through the whole network. And so, and we've had some really interesting experiences lately with our device going into the Canucks and going into the Golden State Warriors and into some MMA teams and various other places. And I think it's just a matter of time until someone from one of those teams ends up being like an ambassador or an influencer of some type. And we're really hopeful that that will help us to kind of get the word out more globally. And I love the idea that the NFLPA and the retired players are really taking an active interest in the young people. So we're actually talking about this project where where we're going to create it's like an RV, it's like a brain bus where it has like little stations inside, so you can do your neural catch scan, you can do your VO2 max, you can look at your metabolic health in a variety of different ways, and then they're going to take this bus and drive it around to events like the Rose Bowl and the various huge football events in the US. And then they're actually going to take it to the high schools. And those pro players are going to drive the brain bus right into the high school and help young people understand how important it is to care for their brain and really promote it. So it's neat that we've been asked to kind of be part of that project. And I'm really excited to see how it turns out. And I think we could do something similar in Canada for sure with the CFL. And we've had the CFL come into the clinic about 2 months ago, and they're coming back, I think, next month to talk more about how we can help in the sports world with preventing and managing concussions. I don't know how many of you watched the movie Concussion, but it really hit me in the heart, and it really reminded me why it's so important that we get out to the young people and help teach them good brain habits right from the get-go. So then again, I'm not going to get into all the numbers, but the actual growth rate has been really, really steady. around this kind of analytics piece, and being able in your clinic to create something objective that you can hand to a client to show them what their own health data looks like. And then, again, this is around performance and using the NeuroCatch to look at different biohacks and different treatment strategies around brain health, and making sure that we're actually making the steady progress that we hope to. If you want to pitch this to a local team, here are some tools. Like, you can talk about, performance and wins, making sure that each player is kind of optimizes, making sure that the team is recognized for taking care of people in their brain, getting fans engaged in the whole initiative, and cost efficiency. So these are some of the things that you might discuss with a team. And we actually have developed, and I have to give huge credit to Nicole Olson from Rebalance, who's also on this call, who went out to her local football organization, actually created a beautiful deck with all the benefits, and did kind of a mass scanning in her own community. And now we've actually expanded on that and created some other decks. So if getting into the sports world is something that you have an interest in, then we're happy to support you with materials. And thanks to Nicole for getting that ball rolling. It was pretty incredible. Nicole's also involved in a lot of seniors health initiatives. And I know she was going to be taking a kid to school, so she might be driving, but if she's not, we'll get her to unmute and tell us a little bit about some of the cool things that she's done in her clinic around supporting her community, and especially supporting the seniors and the youth in her community. And then again, this is something you can use with a sports team to talk about how milliseconds matter. And so this is an example of how a nootropic in particular could, and also over certain training programs like NeuroTracker and other things, they improve visual processing speed, reaction, and then being able to actually measure with the NeuroCatch the impact that we have on those kinds of things, and why it's such an important consideration. And yeah, I'm not going to even go into these slides. I'd rather actually just get into the conversation part, but these are just some examples of tools that we can give you to help with your local teams to drive interest in what you're doing. And then this is to the point of sponsorship. This is what happened. There was a company called Hyperice, and they ended up getting an endorsement from a professional player, and then from there that spun into other professional players endorsing, and then suddenly driving the awareness and the visibility of that company massively. So even though this is going to sound awful, but even though in my head this tool is more designed to helping people in our community and our seniors and our cognitive aging folks and our young athletes, it does really make a big difference to find a player endorsement in terms of getting the word out. And we are getting very close to getting some pretty amazing endorsements over the next, I'm going to anticipate in the next 3 to 6 months. So just be prepared for some announcements to come out, and then hopefully we can use that momentum to leverage in other areas. And then some of the partnerships and the people we're currently working with. So certainly one of the big highlights of my life has been going out to the Navy SEALs and the Top Gun programs and talking to them about some of the research that we're doing on the brain health side, and how protecting the brain, ensuring that it stays healthy and moving things forward in that way is really amazing. And since most of you, I haven't seen a lot of you since this happened, but we did start at our little clinic doing a veteran program, which has rapidly grown into the largest veteran program in Canada. And so working with vets and first responders and some of the implications of brain health for that population have been absolutely mind-blowing. And we are going to be continuing to work on programming that we can put out through the Brainnovation Network, so that our veterans all across Canada have access to the same kind of expertise and services. So that's one of the ways that I hope to help grow your businesses over the next year. And then again, more value to the athlete population. I just wanted to throw those in so that you know what's available to you. And then as we move into kind of dementia and Alzheimer's, now I know that most of the people that I have on this call are more on the physical rehab side of things. So, and I know a lot of this cognitive stuff is related more to the OT side of things. So I won't spend a huge amount of time here, except to say that all of these dementia and Alzheimer's diagnoses, and that gradual decline in executive function has huge implications for their physical health and physical mobility as well. So this is, talking more about the cognitive assessment side, but there is a way to kind of weave that together to talk also about what that means in terms of physical function. And as you can see, Alzheimer's is really like the big growing concern. Prostate cancer and most other heart disease, cancer, and stroke diagnoses have stayed relatively stable, but Alzheimer's is growing at a rate that's absolutely shocking. And so the more we can do, the better. And actually, it's really interesting. I was reading a study about Brain HQ, which is one of the tools that we use quite a bit in our clinic. It's just a cognitive training online. You can do it on your phone or you can do it on a computer screen. And there were a couple of specific exercises in that platform that actually they did a research study that showed that it reduced the incidence of dementia by 60%. And so even retroactively or proactively adding that in when you have someone come to see you actually helps with multiple domains of visual processing, reaction time, fall prevention, assists with, driving safety and a bunch of different things. So even just like layering in it as a course of a standard course of care can have a really big impact. And the other beautiful thing about Brain HQ is that as people train their brain to focus and attend to things, we're actually noticing really big improvements in mood and mental health as well. So there's a kind of some easy wins out there. And again, looking at the prevalence and costs, and again, looking at different ways to use information from NeuralCatch and other tools to improve the outcomes for clients. So behavioral risks, health system benefits, looking at roadmaps for mobility and keeping people safer in their home longer and those kinds of things. And we'll have a whole session in Brainnovation just dedicated to that population, just like we'll have a whole session just dedicated to sports, but this is just kind of giving you the overview. And then looking at healthy cognitive functioning and how it actually can change things and reduce risks. And then looking at using NeuralCatch in terms of actually validating other treatments. So as Patty knows, we've done a few really great projects around PONS. We did a red light, V light study. We're currently working with ShiftWave, which is the chair that you see there, which does a lot of interesting nervous system regulation, looking at things like the immortal chamber in the bottom right, which is a PEMF and red light bed, looking at virtual reality. We're doing several studies right now on psychedelics, and there's some beautiful research on neurofeedback. So if there are any modalities that you're kind of curious about or interested in learning more, it's really, feel free to reach out to us anytime. We're happy to geek out with you on any number of things. And then, of course, our PONS project. You guys all know about the PONS project already, so I won't belabor it. But one of the key things about this is that we were able to actually reduce the cost for an insurer between 1.6 and 1.7 million. And the really cool thing about it is that PONS was a treatment that was not funded by insurance prior to this project. And as a result of these outcomes, we were able to get it funded and get more access for people. So let's unmute again, just because I have been doing all the talking, and I just wanted to check with you guys to see what opportunities do you see emerging in the brain health market? We can talk about any number of things. Whoop. So I know we talked about fall prevention. Go ahead, Marcus.
It's interesting because we just had a session on brain fog just prior to this conference, and then it's almost a universal phenomenon right now. And the question is it something organic? Is it environmental? Is it a combination of both? So I think just since COVID, people's attention span has dropped to the length of a Zoom call, and the fact that we're all looking at screens and how that impacts our health. I think there's almost a limitless possibility here for getting people hope again. I think the messaging traditionally has been that, if your brain is not functioning properly, it's a one-way street. And with everything we know about neuroplasticity and Norman Doidge's work and all this beautiful work, now is the time to give people hope. They still have to do the work, but there's so much potential to keep up hope. Otherwise, the numbers are quite humbling.
Yeah, they sure are.
I Oh, sorry, Tanya. I just wanted to pop in and add to Marcus's comments about brain fog. I think that, you have an entire half of the population, if not more, that go through perimenopause, menopause,
Mhm.
postmenopause, and hormonally. I mean, this is just, I mean, again, that has to do with perhaps hormone replacement or hormone enhancement or whatever they want to call it. But I think there's also so many different types of exercises, and as you're saying, Marcus, that really truly could be marketed and help for women in general.
Hmm.
Yeah,
Hmm.
yeah, agree.
Absolutely.
Yeah. And I think there's lots of room for educating employers and looking at, global health, looking at chronic disease management and, just general brain health, wellness, and vitality. And there are lots of opportunities. I know for a lot of physios and OTs, they're so slammed with their caseload that they're
Hmm.
like, oh, I don't have time to do this. But what we've done in our clinic is build a parallel stream with our kinesiologists where they're looking at, overall kind of health and wellness, metabolic health. We even have, are starting to develop kind of supplement lines that we know based on the protocol. So we don't have to be nutritionists. We don't have to understand all the nuances of that a naturopath or a physician might know. But what we can do is pull on protocols like the Peter Attia stuff and the Andrew Huberman stuff, where it's out in the world with the literature to validate it and specific protocols, and just say, based on what we understand, here are some things that can be helpful. And then it's up to the client to choose whether or not they want to go with that. And we're not trying to say this is our scope. We're saying this is what's out there in the literature that's been demonstrated to help. And we're not prescribing it, but we're making you aware of it. And if that's something you want to avail yourself of, awesome.
Hmm.
And so, yeah.
Hmm.
And the nice thing about that is that it also drives our outcomes. In that they have a better overall experience, they feel better coming out of their treatment with you, and they worked on other factors that can influence their recovery that can be quite dramatic.
Hmm.
Yeah,
Hmm. You say something really interesting about employers, and employers are obviously the largest customers for insurers when it comes to private insurance, short-term disability, long-term disability, extended health benefits, and being able to really jazz an employer around, that push-pull strategy. You have a large employer who's really interested in the brain health of their employee population, and they have 10,000, 20,000, 30,000 employees. All of a sudden you have insurer interest, whether the insurer wants to go there or not. So it really is such a so important that no matter who's coming into your clinic and the kinds of work you're doing, always talking about it, because you never know who you're influencing
yeah.
and how that's really going to play itself out.
Well, and the nice thing is that OTs and PTs have some specialized skills around how to customize an activity program for someone that has chronic pain or a inflammatory condition or whatever. But if at the same time as you're developing your customized program, they're doing other things that help to reduce that inflammation or treat that central nervous system sensitivity in addition to what you're doing, then you get a more kind of wholesome experience. And what I've found about having NeuroCatch and other tools in our clinic is that for the customer, it creates a completely different customer experience.
Hmm.
It's like not like any other physio clinic they've ever been to, where we look at the whole person and the whole person's health versus just like, we're going to treat your knee or we're going to treat your shoulder. And that's optional. Like they don't have to opt into, they can come in and just get a knee treatment if they want. But if they want to look at, okay, well, here's all the contributors to the inflammatory process. Here's some things that are going to help with tissue healing. Here's some things that are going to, support your sleep or metabolic health or whatever. They just come away with such a different experience. And I think like looking at the Google reviews, and I'm not doing as much active treatment at SNPC as I am overseeing treatment, but I get the joy of reading the Google reviews that go on for pages. Like it's not like, yeah, 5 out of 5 had a great experience. They want to write a paragraph about how it changed their life. And that I think is the difference, right? You want to create those really meaningful client experiences that people step away and feel like that they had an experience like they weren't expecting, and it's changed their life.
Hmm.
Yeah. And then one of the things I was going to share, so unfortunately we don't have back in action here from Toronto to talk about some of the cool kind of metabolic global health stuff that they're doing. They're also really enabling other clinics to do more kind of biologic testing beyond just the standard stuff, which is really neat. But I will have her on as a feature speaker because she's just done incredible things with her business. They actually took Back in Action, which was a straight up kind of chiro physio massage clinic, and they've turned it into the Institute for Science, Health, and Performance, I think it's called. ISHP labs, and they've created like a lab, like a health lab. And then all of the different therapies are in service to this whole metabolic health picture, and it's growing like exponentially. And so she is, I've said to her, teach us how you did that. That's just really cool. So hopefully she can teach us all how she did that. But we did put together like an employer wellness program, and our kinesiologist put all of the topics together, and they went out, and basically employers buy in. It costs them like $250 a month. It's not expensive. And we can do it by Zoom. So we can, treat a remote group, but we can also do it in person. So depending on how far away the employer is, we can either go in and do a lunch and learn with them in person, or if it's a remote employer, we can do it by Zoom. And then every quarter we go in and do brain scans and talk about brain health with their clinic. So they might have 50 or 100 people come in and actually have their brain scanned. And the neat thing about it is, like, January, we talked about mindset, February, basics of brain health, March, sleep and restoration. You can bet when we did their scan in January and then we did their scan again in April, there was a significant improvement in their scan results because they're taking better care of themselves. And then, the next quarter we focus on 3 other great topics and then rescan again. And then the next quarter, 3 more great topics. And even if their scan, because they had a bad sleep the night before or something, like, there's always a discussion that we can have around, well, this is what this means. Like, sleep is really important. And here you can see why it's important. Or you're really dehydrated today because you had 4 coffees and no water. And this is what it does to your brain. So it stimulates all these deeper conversations. But what's really cool about it is that those employers see us as the place to go to get comprehensive care. And so it spun off into all kinds of other opportunities. If they have a sore back, if they twisted their shoulder, if they haven't, a mom who's getting dementia or something, then automatically they think of our team as the team to come to. So sometimes it seems like it's not a lot of money, or it seems like a lot of work at the front end, but the spin-off from it is pretty remarkable. And we've been really happy with the relationships that we're building as a result of doing this kind of work.
Tanya, how is Surrey Neuroplasticity Clinic finding those employers? Are there that might be helpful?
We went out to our local Chamber of Commerce and did a talk, and then that attracted, and we also gave them a little bit of a discount on this particular service. Like, your first month is free, or, you get 10%. It depends on the employer and the size and all that kind of stuff. But a Chamber of Commerce is a great place to get out to, just to let them know. And we also just, in the office towers near us, we went around with a little flyer and just, talked to the businesses nearby, and that generated a lot of interest as well. But the neat thing about it is, if you can talk the employer into doing something measurable, like days lost from work, or, a productivity measure of some kind, then you can also show that it actually, we talk about it as thinking about thinking, like how thinking impacts your ability to do good work and be healthy at work. And so often we're not through our first year, but once we get through our first year, we want to look at, like, did you have less time lost? Did you have higher engagement scores? Like, any number of things that will help show employers that this is a really worthwhile investment. So
Excellent.
yeah, that was one of our ideas that worked really well. So I'm hoping, since I have everybody on the line, if there's any other ideas that you've had that have worked really well, like, feel free to share them. And every single month when we do our rounds, we'll just do that. We're just gonna, like, our goal is to support each other and to expand the network.
I think the litmus test I always tell the people, would you do it for free? And so all of us in the early stages of this are kind of doing a lot of stuff pro bono, which I don't think we would do if we didn't believe in what we're doing. I mean, most people don't do stuff for free unless they see the results, and
Yeah.
that's satisfaction. If it doesn't pay the bills at the end of the day, which all of us as business owners have to do, but I think that's almost secondary to building the successful platform on which, if you build it, they will come, as the old saying goes.
Yeah. That's
And
been my experience for sure. And sometimes there's just a tipping point. Like
mhm,
you trundle along and it's so frustrating. You're like, how am I going to make this work? And then one idea hits and then wham, you're like, oh, okay, we're over the hump now. Great. I know for us, getting the volume of scans up was really hard. But
mhm,
then now that like we're going to the local arenas and posting posters about getting your benchmark scan and but
mhm,
not just getting your scan because you want to know what your brain health is, but then pairing that with a performance protocol, we can show you how to increase the speed of your,
mhm,
reaction or your thinking. Or and these kids like they want to be the best in their sport. They want to go to the NHL or they have aspirations of these things. And so, we can work with them to help them understand the tools that they have at their disposal.
mhm.
Karina,
Yeah.
did you have a comment? I saw your mute go on and off a couple of times.
Oh, yeah, I was just thinking, did for when you're bringing on more of like this kind of stuff to get research money and stuff, does anybody kind of add maybe like a non-for-profit piggyback company to theirs, where it's like the research side, where like those two sides of the company can support each other to try to get more like funding maybe for research when we're starting or anything like that?
Yeah, and actually, if you have an idea that you want to find grant or loan money for, we actually hired a full-time grant writer slash grant searcher, and she's been super successful at helping us find funds for lots of different initiatives like this. And so there's also quite a lot of funding in the US. So if we actually apply as a network, as a whole network, where we talk about a North American strategy, there's some really interesting things going on around cognitive aging where they're giving out lots of money. So we've been applying up a storm for grants, and we've been really fortunate this last little while. So we got the ICE grant to develop a concussion index. And I just applied for, I think, $1.2 million with the military to look at a pain and PTSD program that treats those two conditions, not so much as musculoskeletal or mental health, but as neuroplasticity problems. If I get that grant, then we'll be putting some work out through the network to collect data for that. And then there's some of these fall prevention, fall risk, cognitive aging projects that we're going to be putting in lots of grant applications for. So
Do you think it'd be worth developing a not-for-profit company attached to your company so you could qualify for those, or do you think we would still qualify
yeah,
if
we
we
actually
weren't?
we actually have one. So we can go through, we have Healthy Brain Foundation.
Yeah.
So we can apply as a nonprofit for those things. We're just getting ready to do a big application to the Kids Brain Health Network to work with neurodiverse kids. So yeah, we do actually have a mechanism. So that's why I'm saying if you have an idea and you don't currently have a nonprofit option or a research
Okay.
foundation, you can
Go
use
through.
ours. Yeah.
Okay. But
And
it might be worth in the long term to kind of think about building that up in the long term too,
Yeah,
though.
well,
Okay.
and
Okay.
that's
absolutely.
a fabulous segue because I know we're in our last minute, but a fabulous segue into our next clinical round that maybe,
Yes.
Yeah.
Annie, you want to tell everybody a little bit about.
Sure. So we've got Sonia Brody coming to talk about how to embed research into clinical practice, how to get involved in
Oh,
our
perfect.
grants, and how to get it and how to bring your good ideas to life. So she's going to be helping us with some of the creative ways that they've found funding, and
And
also,
yeah,
easy ways to write up a case study or ways to submit things that might be helpful, especially if you come across something really cool that you want to explore. She's magical at that kind of stuff. So yeah, she's going to be our next speaker.
and that's actually on October 3rd, and I'm sending out the invite for that, the Eventbrite description today. So you'll be getting it in your inbox.
Is
And
it the
if
same
you have
time?
any ideas or speakers
Yes,
that you
it'll be at the
want,
same,
like
sorry,
Okay.
it'll be
send
at the
us,
same time.
yeah, send us your ideas. We will probably do this next one at the same time, but then we're probably going to move to a later in the day slot so we can pull the Australian folks in. But for the next two, they're already pre-booked, so it'll be same time as this one. And thank you guys for giving me your time. I love brainstorming together, and I love the momentum that we're getting, and it's my goal to bring everybody along.
Thank you,
Yep.
Tanya. Patricia, you guys are inspiring. I got to run to the conference, but good
Yeah,
to see you all.
Enjoy.
Yeah,
Yeah,
bye.
thank you.
thank you all.
Perfect.
All
Thank you
right.
so much.
Bye.
Have a good
Bye-bye.
Bye.
day.